Well, hello, welcome. This is Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center. This show is for you, by you, and about you. Tonight we're going to be talking about stroke because is it National Stroke Month? I forget. And we're going to be talking about osteoporosis and osteopenia. That's some bone problems that we have, primarily women, but men do have it as well. And so we're going to start off with stroke. I'm live tonight. This is June 2nd at 7:03, 2021, and my number is 407-1111. If you have anything you want to say, you do not have to call and discuss stroke or osteoporosis or osteopenia. We can talk about whatever you want to talk about. So if you're interested, give me a call. So, what is a stroke? Well, a stroke occurs when a part of your brain loses blood to the brain. It's interrupted or it's reduced, preventing brain tissue from the oxygen and nutrients it needs to survive. Brain cells begin to die within minutes. A stroke is a medical emergency and timing is crucial. So if you have any of the signs of a stroke, do not drive to the hospital, call EMS, tell them you think you're having a stroke and tell them what your symptoms are, because they can start getting things going while they're in the ambulance on the way to the hospital. Early action can reduce the brain damage and other complications. Fewer Americans are dying of stroke now because of advanced treatments and effective treatments. And also there's been a big push educationally. You'll see billboards that say, what are the 4 signs of stroke? Some say 7 signs of stroke. And so when you have those things, you need to, like I said, call the EMS and get to the hospital as soon as possible. And you know what? If it's a false alarm, if it isn't a stroke, your health and your well-being is worth that mistake. And I think most caregivers, most medical personnel feel that way, because you don't know when you're going through something. All you know is what you've learned about through this program, through billboards, through talking to your doctor. And so you just do what you have to do for the best of you. That's my advice to you. So let's see, where did I write that? Oh, the seven causes or signs of a stroke. There's a couple different views, so I'll go through one and then I'll go through the other. So if you have any loss of motor function, you can't speak, your hand doesn't work, you can't grab, it just kind of hangs. If you have weakness of any sort, your legs are so weak you can't hardly move them. If you have any risks from high blood pressure, if you have high blood pressure and you're not seeing your doctor on a regular basis, or even if you have, and you have some maybe slurring of your speech or drooping of your face. Those are things that can happen with high blood pressure. Headache, of course, is one. But if you have high blood pressure, you're at an increased risk for strokes. Drooping of your face. If your face is asymmetrical, if you do a smile and one side is drooping, and it looks like that, that's a bad sign. Get to the emergency room immediately. Headache, now I'm not talking about your routine, the weather's coming, I have a headache, or I woke up this morning with a headache, it's okay, I took some ibuprofen. I'm not talking about that kind of headache. I'm talking about the worst headache you've ever felt in your life. You've never experienced a headache like this. That's the kind of headache that would go with a stroke. If you have trouble speaking, maybe your brain is saying, for you to say a word and it comes out a different way, way, or if you have trouble understanding what other people are saying, it's time to go to the emergency room. If you have paralysis or numbness in the face, arm, or leg, meaning you can't pick up your arm, you can't move your leg, that's paralysis. It won't go anywhere. If you have sudden, blurred or blackened vision, or in one eye or both, or you see double. And I'm talking about you're walking along, you feel fine, and all of a sudden your vision is blurry. That's a problem. All right, we talked about the headache, and sudden, severe, and it can also be accompanied by vomiting, dizziness, altered level of consciousness, and trouble walking. If you have trouble walking, you stumble or lose your balance, you have sudden dizziness or a loss of coordination. That's a sign for stroke. So, I think you should go to the ER. Now, if you have some of these symptoms and they come and they go away, that's one thing. You don't necessarily have to go to the emergency room then. But if you have any problems other than that, just go to the ER. It's just easier than to try to differentiate what might or might not. So you think FAST. That's one of the acronyms. FAST. Face. Does one side of your face droop? Arms. Can you raise both arms? Does one arm drift downward, or is it unable to rise? That's A for in FAST. Speech. Ask the person to repeat a simple phrase. John Black went home. If his speech is slurred or strange, that's when you seek immediate medical attention. And time cannot be emphasized enough. If you don't get to help in enough time, if too much time has lapsed, you're going to possibly cause some permanent damage. So, really the thing is, any of these things happen, go to the ER. So what causes a stroke? Well, there's two different causes. One is called ischemic stroke, and that is a temporary disruption of the blood flow to the brain. And the other one is, and that's from a blocked artery. Then you can have leaking or bursting of a blood vessel. That's a hemorrhagic stroke. Brain and blood don't get along. The brain does not like blood. And so that you have to get there immediately. If it's an ischemic stroke, where you have a blocked artery, usually from some plaque that breaks off of your artery and goes like maybe into your carotid artery, that can be, you can give a clot busting drug, and that can open up that vessel, and then the blood flow gets back into your brain. That's the kind, if you got to have a stroke, that's probably the best one, although there isn't a good way to have a stroke. But the hemorrhagic one, we don't know what's happening, we don't know how it happened, but you're going to have to probably get to emergency surgery to evacuate that blood and get rid of any blood clot up there, so your brain tissue has time to heal. Ischemic stroke, the one with the plaque that breaks off, is the most common, and that happens when your blood vessels become narrowed or blocked, and they cause a severely reduced blood flow called ischemia. Blocked or narrowed blood vessels are caused by fatty deposits that build up in your blood vessels, or by blood clots or other debris that travel through your bloodstream and lodge in the blood vessels in your brain. That's why it's so important to have take your lipid lowering medicine. And there's a lot that we're learning about lipid control. A lot of new drugs are out. Of course, they're expensive, but you know, you gotta weigh, you know, I know it's expensive, but isn't your life worth it? But, you know, some of the drugs that have been around forever, called statins, are very effective drugs. Now, there is something called statin intolerance, and some people do have that. But there are other drugs that they can have that are not statins that can still help them some. But it's important to keep your lipids under control. That's one of the big things of preventing a stroke. And some initial research has shown that COVID-19 may be a possible cause of some ischemic strokes. They also have been known to cause blood clots. But that is a continuing study, as is everything with COVID, because it's so new, excuse me, and they just don't have all the science and all the studies, and they just don't have it all yet. And so the hemorrhagic stroke occurs when a blood vessel in your brain leaks or ruptures. The hemorrhaging can come from many conditions, such as uncontrolled high blood pressure, overtreatment with blood thinners, an anticoagulant, bulges at weak spots in your blood vessel walls called an aneurysm, trauma, such as a car accident or a fall and you hit your head, protein deposits in blood vessels that lead to weakness in the vessel wall called cerebral amyloid angiopathy, or an ischemic stroke that leads to hemorrhagic stroke. Less common cause of bleeding in the brain is the rupture of an abnormal tangle of thin-walled blood vessels called arteriovenous malformation, although I've seen that in several patients. A TIA, transient ischemic attack, or it's also known as a mini stroke, is a temporary period, excuse me, of symptoms similar to those that you'd have in a stroke. The TIA does not cause permanent damage. They're caused by a temporary decrease in blood supply to part of your brain, which may last as little as 5 minutes. Like an ischemic stroke, a TIA occurs when blood clot, or when a clot or debris reduces or blocks the blood vessels to part of your nervous system. And sometimes having a TIA can be a precursor to having a stroke. So if you've had some TIA symptoms, you need to talk to your doctor, and he might want to order, you know, some imaging angiography or something like that, so they can see if there's going to be a problem in those vessels, and then they can, you know, do surgery or get rid of them or whatever they need to do. So what are some of the risk factors? Well, as usual, being overweight or obese. Physical inactivity, you know, how many times have I told you, eat right, move. Heavy or binge drinking. Use of illegal drugs such as cocaine and methamphetamine. Medical risk factors are high blood pressure, cigarette smoking or secondhand smoke exposure, high cholesterol, diabetes, obstructive sleep apnea, cardiovascular disease including heart failure, heart defects, heart infection, or abnormal heart rhythms such as atrial fibrillation, and a personal family history of stroke, heart attack, or a TIA. And now they're adding the COVID-19 infection. Other factors that have to do with the risk of stroke is your age. You know, the older you get, the more higher possibility you have to having a stroke. Race. African Americans are at a higher risk of stroke than people of other races. Sex. Men have more strokes than women. Women are usually older when they have strokes, and they're more likely to die of strokes than are men. And hormones. Use of birth control pills or hormone therapies that include estrogen can increase the risk. So some of the complications of a stroke is paralysis. You can lose your ability to use your arms and legs. If just the arms, the upper body, or just the legs is called hemiparesis. That means half of you works and half of you doesn't. Difficulty talking or swallowing. The stroke might affect your swallowing muscles, making it difficult for you to talk clearly, swallow, or eat. A lot of people that have strokes have got to have speech therapy to learn how to chew and swallow again. Or they have difficulty with language and they have to learn how to speak again. Memory loss or thinking abilities. When a stroke, affects part of your brain, and it could be the part where your memory stays. Others have difficulty thinking, reasoning, making judgments, and understanding concepts. They have emotional problems. People who have strokes have more difficulty controlling their emotions. They may develop, Lord, I forgot the word, depression. And then pain or numbness or other unusual sensations may occur in part of your body that's affected by the stroke. If a stroke causes you to lose feeling in your left arm, you may develop an uncomfortable tingling sensation in that arm. And then changes in behavior and care ability. People who have had strokes become more withdrawn. They may need help with grooming and daily chores. All right, it's time for our first break. And so when we come back, we'll talk more about strokes, and we'll go into the prevention of strokes. And I'll see you back in just a few minutes. Don't go away.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
Hey, welcome back. This is Here's to Your Good Health. I'm Linda Prezioso, nurse practitioner at Family Medical. And we've been talking about stroke, and now we're going to talk about prevention. So what is the best, how do you prevent a stroke? Nobody wants to have a stroke. Number one, control your high blood pressure. You know, the lower your blood pressure, the better off you are. Anything, you know, we try to get you to about 130 over 80. And we don't like people to go over that. Some people are very hard to control, and so we'll go up to 140 over 90, but we like 130 over 80 or less. Lowering the amount of cholesterol and saturated fat in your diet. You know, saturated fat, trans fats, all that can build up in your arteries, so if you don't eat that, then you know, you're not going to have as much in your bloodstream, and so hence you're not going to be as high of a stroke, of risk for a stroke. You know, I've talked before about eating more plants, less meat. I think we need some protein. I don't necessarily believe that we need to eat all plants and nothing but you know, we all eat too much trans fats in this country. Any cakes and cookies and honey buns and ho-hos and all that kind of stuff that, yeah, it tastes good, but it's all full of sugar, fat, and salt, and all of that can lead up to a stroke. If you smoke, quit. Managing your diabetes, be sure you diet, use the ADA food guideline as much as possible, and keep your blood sugar in a good range. You know, some surgeons are not even going to do surgery on you if you do not have your A1C at 6.5 or less. Then, you know, goal for us docs is 7, but surgeons want it lower than that. So. Not that you have to have surgery, I'm just saying that we need to keep our diabetes under control. Maintain a healthy weight, get to where you want to be, and then stay there. You know, rich diet full of fruits and vegetables, 5 or more servings of fruits or vegetables. Mediterranean diet is a great one to take. That's a healthy diet. They emphasize olive oil, fruit, nuts, vegetables, and whole grain. Exercise regularly, and you know, I know that's hard. I've had to start getting up 15 minutes early in the morning so I can get on my elliptical and do some exercise before I go to work, because I've got something to do after work, so I have to do it beforehand. Drink, if you're going to drink alcohol in moderation. It's just probably better not to drink at all, but I understand people like to have a cocktail or they like to have a glass of wine, and there's nothing wrong with that, but control what you drink. And if you have sleep apnea, obstructive sleep apnea, that is you have to have that taken care of and controlled as well. That can be a risk factor for having a stroke. And of course, avoid illegal drugs. I mean, that kind of goes without saying with anything. But If you've had a stroke or a TIA, there are some blood thinning medicines. There's antiplatelet drugs, and platelets are the part of your blood that forms a clot. And so antiplatelet drugs make these cells less sticky and they don't clot as much. The most common antiplatelet medication is aspirin. And then, you can get one anywhere from 81 milligrams to 365 milligrams of aspirin. Then there's some other ones called Agrinox, which is a combination of a low-dose aspirin and the antiplatelet drug, dipridamole. Then there's Plavix. I'm sure all of you have heard of Plavix. And then there's anticoagulants, which stops the clotting of the blood. Heparin does that. Coumadin does that, called warfarin, and that's, it's rat poison is what it is. But you really have to monitor that, and it can get out of whack. You have to watch what you eat. So we have a Coumadin clinic at our office, and Joyce is great about that. She'll take your blood. She'll let you know what the results are. One of our doctors will say that's good or reduce it. They adjust the doses needed. So you're going to have a blood draw. I think it's about every 2 weeks if you're going to be on warfarin. But there's some newer ones, Pradaxa, Xarelto, Eliquis, and those don't require the blood test, and they're not quite as dangerous as the Coumadin, although, any blood thinner is dangerous because you're thinning your blood. Anytime you put something in your body that's going to change the way it works, there's going to be a possibility of a problem. And, every medicine, even aspirin, has a side effect, and some of them are pretty scary if you read up on them. So we're going to move on from stroke, and we're going to go to osteopenia, which is, it's kind of a step before osteoporosis is what it is. It's a weakening of the bone. And so, it's halfway between healthy bones and osteoporosis. Here's osteopenia. And that's when your bones are weaker than normal, but they're not so far gone that they break very easily. That's the hallmark of osteoporosis. Your bones are usually the densest when you're about 30. And osteopenia, if it's going to happen at all, occurs after age 50. The exact age depends upon how strong your bones are when you were young. If they're hardy, you may never get osteopenia. If your bones aren't naturally dense, it might happen earlier. Osteopenia, or seeing it turn into osteoporosis, is not inevitable. Diet, exercise, and certain medications can help keep your bones dense and strong for decades. So who is most likely to get osteopenia? Some people are genetically prone to it, and this happens when your body gets rid of more bone than it's creating. Most people have it, it's in their family, and more women get it than men. Women have lower bone mass than men. Women live longer than men normally, so their bones age more, and they usually don't get as much calcium as men. I don't know why, but calcium is the key to keeping bones healthy. Hormonal change that happen at menopause increase the chance for osteopenia for women. And men with lower testosterone levels have higher odds of getting it. So your hormones have a lot to do with your bone health. And sometimes you might have a medical condition that triggers osteopenia. That could be eating disorders like anorexia or bulimia, untreated celiac disease, an overactive thyroid, and thyroid is a hormone, chemotherapy, if you have had to have chemotherapy to treat cancer, and certain medications, steroids, hydrocortisone, prednisone, and anti-seizure drugs such as carbatrol or tegretol, gabapentin, or dilantin, all have the propensity to make your bones less strong. So in order to keep our bones strong and healthy, we need to make sure we have enough calcium. Vitamin D is a good combination with calcium. The calcium helps the vitamin D absorb, or maybe it's the vitamin D helps the calcium absorb. I forget which. I get it backwards. The causes of osteopenia can be lack of vitamin D or calcium. It can be lack of exercise. You've got to strength train. Smoking, too much alcohol, and carbonated beverages. Now, I didn't know that, but carbonated beverages, that's a lot of stuff. Any soda is a carbonated beverage. They have carbonated waters. They have like tonic water as a mix for alcohol. Even like ginger ale, it's all carbonated. So when your provider tells you only drink one soda a day, and that's a lot to me because I drink primarily water. I drink coffee and water. That's about my only things I drink. Once in a while, I'll drink a carbonated water or a flavored water. I just get tired of plain water sometimes. Now, as far as diagnosis, osteopenia normally doesn't have any symptoms, and that makes it hard to diagnose unless you do a bone mineral test, bone mineral density test. And we do those at our office. I imagine anybody that has an X-ray department in their building has the bone densities. And once you hit menopause, age 65, then there's really no reason not to do a bone density. I usually start them after they've not had a period for a couple of years, because then the estrogen is pretty depleted. And so that I usually start at about 55 getting bone densities. Or I would start earlier if it was strong prevalence in their family, or if they had other risk factors, other genetic problems that could cause osteopenia or osteoporosis. But normally, the National Osteoporosis Foundation recommends any woman 65 or older to have it. If you're a postmenopausal woman, 50 or older, you're a woman at the age of menopause and have a high chance for risk of breaking a bone. You're a woman who's already been through menopause, younger than 65, and have other risk factors, you would get a bone density. If you're a man older than 65 with risk factors, we'd do a bone density. If you break a bone after age 50 without significant trauma, known as fragility fracture. My oldest granddaughter, when she was little, her other grandmother has osteoporosis, and I think Caitlin was about 3 or 4, and she stepped on her grandmother's foot, and she broke her grandmother's foot, and that was because of the frailty of her grandmother's bones, because a 4-year-old doesn't weigh that much. And that a bone mineral density is fast, it's painless, it's like getting an X-ray. You lay on that table for a few minutes, she does some X-rays, and you're done. It's never too early to start prevention of osteopenia. talk with your doctor about an exercise plan that's right for you and eat the right kinds of food. You know, just walking every day will help prevent osteopenia and osteoporosis. And if, of course, getting out calcium and vitamin D. You can get calcium in dairy products, anything that is, no, let me take that back. You can get calcium in dairy products, yogurt, cheese, milk, spinach, broccoli, dried beans, salmon. Vitamin D, which helps your body absorb calcium, can be found in eggs, oily fish, salmon, and sardines. And a lot of foods that are said to be fortified milk will have D in it. Orange juice, cereal, bread, they will add that to that food. It's also a good idea to spend 10 to 15 minutes in the sun twice a week. This helps convert inactive vitamin D to the active form. If your doctor doesn't think you're getting enough calcium and vitamin D, they might suggest you take a supplement. I have all of my folks on supplements. And there's not really any reason not to take calcium or vitamin D. And they make a calcium and vitamin D combination supplement, so that just makes it easy. You get both of them in one pill. Weightlifting, weight-bearing exercises help slow osteopenia. You know, quit doing the smoking, quit doing the alcohol, quit doing the carbonated drinks, all that will help. And there's several different medicines used, and we'll go over those in just a minute. But it's time for our second break. So we are going to stop, and when we come back, we will talk about osteoporosis, which is different than osteopenia. So don't go away, and we'll be right back with more of Here's to Your Good Health. Hang on.
To taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently. So we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Hi, I'm Richard Koss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports, to compression hose, to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
Hey there, we're back. This is Linda with more of Here's to Your Good Health. Now we're going to move into osteoporosis, which is your bones become weak, brittle. So even a fall or a mild stress such as bending over, coughing can cause a fracture. Osteoporosis-related fractures commonly occur in the hip, waist, or spine. Bone is a living tissue that is constantly being broken down and replaced. Osteoporosis occurs when the creation of new bone does not keep up with the loss of old bone. Osteoporosis affects men and women of all ages, but Asian women and white women, especially older who are past menopause, are at the highest risk. So typically there are no symptoms in osteoporosis, but once your bones have been weakened, you might have back pain caused by a fractured or collapsed vertebra, loss of height over time, a stooped posture. I'm terrible about that. A bone that breaks more easily than expected. And you might want to talk to your doctor about osteoporosis if you've gone through early menopause or you took corticosteroids such as prednisone for a long time, or if either of your parents had a hip fracture. So some of the risk factors for osteoporosis is your sex, your age, your race, family history, and body frame size. Men and women who have a small body frame tend to have a higher risk because they have less bone mass to draw from as they age. Hormone levels, sex hormones, lowered sex hormones such as estrogen or for women, testosterone for men, that can weaken the bone. And men that have a gradual reduction in testosterone, like I said, have that problem. Thyroid problems can cause that. If you have a low calcium intake, that can be a problem. Eating disorders such as bulimia, those kind of things, severely restricting food intake and being underweight weakens the bone. And then if you've had gastrointestinal surgery, like a weight loss surgery, that prevents some of the ability of you to be able to absorb nutrients such as calcium, and then those problems can lead to some osteoporosis. Steroids and other long-term medication has been associated with osteoporosis: seizure medicine, gastric reflux medicine, cancer, transplant rejection. Medical problems that may cause or increase the risks for osteoporosis are celiac disease, inflammatory bowel disease, kidney or liver disease, cancer, lupus, multiple myeloma, rheumatoid arthritis. And of course, then the same lifestyle principles apply for osteoporosis as in osteopenia. Don't drink to excess, eat less, eat healthy, exercise daily, don't smoke. Bone fractures, particularly in the hip or spine, are the most serious complications of osteoporosis. Hip fractures are caused by a fall that can result in disability and even an increased risk of death within the first year after the injury. In some cases, the patient hasn't fallen. The bones are so weak they just crumble, and that can cause back pain, loss of height, and hunched forward posture. So prevention is, healthy lifestyle, keeping your bones healthy throughout your ages. Protein is one of the building blocks of bone, so you have to have protein. How much you get, that's under discussion. Vegetarians and vegan can get enough protein in their diet if they intentionally seek suitable sources: soy, nuts, legumes, seeds for vegans and vegetarians, dairy and egg for vegetarians. I don't think any of us have a real problem with protein in this country, and now protein drinks are so popular. They fill you up and they cause you not to eat less, and so we love those. And we talked about calcium, and we talked about vitamin D, and we talked about exercise. So a lot of the osteoporosis goes hand in hand with the osteopenia. If you've got osteopenia, you want to work extremely hard to prevent osteoporosis. You don't want to get osteoporosis. That's much more devastating, much more debilitating. And so we want to stay away from that. So once again, we move into what do we need to do? Diet, exercise, get good sleep. It's the same pathway over and over and over again. But yet we tend to eat junk. We tend to go out too much. We tend to not cook, and then we don't want to cook healthy. When we do, we're going to, it's great to throw a pork chop on the grill, but, how about sauteing or grilling some eggplant and some zucchini and some yellow squash? I love it like that, just barely, just take a little bit of the crunch out, or to roast them. I love a roasted, what are those little cabbages called? My brain went dead. My brain is gone. But Brussels sprouts, that's, Brussels sprouts. Green leafy vegetables are better for you. They have a lot of calcium in them, so you want to try and eat a lot of that. Broccoli is probably one of the best superfoods there is. And of course, what is the one green that I don't, well, there's a lot of greens I don't like. I don't like kale. I don't like collards. I don't like, what do you call salad around here? Mustard greens. I really, they're all so bitter to me, and maybe I just haven't had them cooked properly. I force myself to eat broccoli. I force myself to eat kale. I do like a kale salad. I've had kale salads that were very good. And like spinach, I don't like it cooked much, but I love raw spinach. So a lot of times when I get a salad from the salad bar, I put all spinach and no lettuce, especially iceberg lettuce. There's no nutritional value. It's just water is what it is. But it's just important to eat right. If we're going to put junk in our bodies, we're going to get junk as a return. That's the same as putting bad gas in your car. You know what happens when you do that. The car doesn't work right. It sputters and puts. Your engine isn't maintained, isn't running smoothly, and our bodies are the same way. So we can't expect to put junk in our bodies and then have good health. So, you know, and that's what I'm all about. I'm all about good health. I'm all about eating right. I'm all about exercising. I'm all about natural products as much as possible. I'm all about what God has given us. I try to stay away from a lot of the pharmaceuticals. Now, I'm not saying you don't need pharmaceuticals, but because we all do. And I write for pharmaceutical products every day. But if I had my druthers, I'd druther that you ate right and exercised and got healthy that way, and getting your body into a good weight so you don't ever have to go on medicine for diabetes. Now, I'll tell you that most people are not going to be able to get away from high blood pressure. At some point, our body wears down a little bit. Our vessels get a little broken down. They don't expand. They don't have the elasticity that they did when we were in our 20s and 30s. So some of that, especially high blood pressure, about 90% of us have some kind of high blood pressure. So that is, and I don't know why. I guess it's the vessel health. I don't know for sure. But most of us have essential hypertension. Some of us have hypertension caused by maybe some kidney problems or things like that. But most of it, if we eat right, and if you start when you're young, I'll have people that say, yeah, I'm going to eat right, and they will, but then they buy chips and soda for their kid. Well, you want to teach your kid to eat right so he doesn't end up, you know, coming to see me every 3 months. And I think there's a big pendulum swing now towards more healthy ways to do things. I mean, you know, every fast food restaurant has a salad now. You know, you're having grilled foods, you're having meatless hamburgers. They're pretty good. They're expensive, but they taste, to me, it tasted just like a hamburger. So there's a lot we can do, and you know, we're not going to get any of this done overnight. It takes a long time. Well, some people say it takes 61 days to change a habit. I think it takes longer than that, especially the older we get, the longer we're in that habit. But, you know, we just have to do our part. When we do our part, then there's going to be unfortunate people that no matter how well they eat and how much they do, they're still going to have medical issues. That's who they are, their genetics, and we can't stop all of it all the time. But for the most part, if you eat healthy, if you move, if you drink mostly water, you're going to be okay. So that's it for tonight for Here's to Your Good Health, and I will see you next week with more. No, excuse me, I will not be here next week. I am on vacation. I'm going to the mountains to see my son. I'm going to Asheville for a few days, and then we'll be coming back home, and I'll be working in my garden, trying to get my garden weeded and situated, and I've had beautiful weather. I can't complain. Just not quite enough time. So I will see you in 2 weeks with more of Here's to Your Good Health. Have a great night. Good night.